News 10-6, the Omicron variant has arrived in Minnesota just a day after the nation's first case of the coronavirus offshoot was detected in California. KIMT News 3's Anthony Monzon has been following the news and joins us live with what experts, leaders, and locals are saying about the virus tonight. Anthony?
That's right, Katie. The second confirmed case of the Omicron variant has been identified just up the road from us along Highway 52 North in Hennepin County. Now, there are three messages we're consistently hearing from public health experts. The first, go get vaccinated. The second, there's still a lot we need to learn about this variant. And the third, its spread is reason for concern, but not panic.
It's not surprising that it showed up. It is an area that we need to show caution and concern around. We're learning more every day.
Governor Tim Walz reacting to news of the nation's second case of the coronavirus Omicron variant being found in Minnesota. Omicron was first identified in South Africa last month, and the CDC says it may spread more easily than other variants, including Delta. Breakthrough infections among the fully vaccinated are expected, according to experts, though they believe vaccines are still effective against the new variant. The Minnesota Department of Health says the Hennepin County man infected with Omicron traveled to New York City to attend an anime convention between November 19th and 21st. The man has since recovered, but had previously been vaccinated more than 6 months ago and received a booster shot early last month.
We may see a reduction of protection against severe disease and hospitalization.
Mayo Clinic Director of Clinical Virology, Dr. Matt Binnicker, shares early evidence suggests the Omicron variant's unusually high number of mutations may impact the efficacy of vaccines and natural immunity.
I don't think this is going to be an impact from 90% protection to zero. It's going to be a sliding scale.
While Dr. Binnicker doesn't believe the Omicron variant is already spreading widely in communities, he does think it's present.
They actually have gone back now different countries and tested samples from the middle of November and are finding Omicron in patients who tested positive as early as November 19th, November 9th. And so that tells us that the virus is more widespread than our testing or our sequencing is telling us.
A survival of the fittest between the Omicron and Delta variants is now underway, according to the doctor, to be decided over the next few weeks by which is more transmissible. In the wake of today's Omicron announcement, Minnesota resident Deb Kalinsky had this message for all.
Get vaccinated. That's what I think. You know, why it's here because no one's vaccinated, right? Get the booster, do what you're told to do, and quit being stubborn.
Now, Dr. Binnicker does offer some good news on the Omicron front. He says so far cases that have been identified across the world appear to have been mild. Live in Rochester, Anthony Monzon, KIMT News 3.
Thanks, Anthony. The Minnesota Department of Health says it's evaluating less than 10 other specimens that could also contain the Omicron variant.